doctor.
Your heart needs to be strong to keep up. Flora, for a strong heart today.
Thank you and welcome to the show. A little while ago, we highlighted the humble toothbrush as a cheap and powerful weapon against heart attacks and strokes, based on the American Academy of Periodontology statement that people with gum disease are almost twice as likely to have coronary artery disease. We even brought in an international professor who said the same thing based on recent research. It turns out that those findings may have been overstated, as more recent research is indicating that there isn't a causative link between gum disease and heart health, just an association. So what does that practically mean for us? Can we stop brushing our teeth? Of course not. Even if periodontal disease isn't actually causing heart disease, the connection could still be important, because gum disease might be an early sign of cardiovascular problems. You won't ever feel your arteries hardening or your cholesterol rising, but you might notice bleeding or painful gums. Think of gum disease as the skin on your hand. If your hands bled every time you washed them, you would know something was wrong and you do something about it. Your gums are no different. And we know that early detection and intervention can save lives and prevent 80% of unnecessary heart attacks. So when it comes to heart disease, my advice is to stick to the basics and do what needs to be done to minimize the risk factors for heart attacks and strokes, namely high cholesterol, high blood pressure, diabetes, smoking, and an inactive lifestyle. And then, to be extra safe, even if science is unsure about the connection, I'd suggest you take good care of those gums with a good regular routine, which is why I've asked Dirna to demonstrate the most efficient and effective oral care routine. Dirna, welcome to the show.
Thank you for having me.
If I listen to my dentist, it feels like I've got to spend 15 to 20 minutes every morning sorting my teeth out. I've only got 3 minutes. What should I do in those 3 minutes?
Okay. Most important thing was stay brushing them thoroughly. Okay. You have to spend at least 2 minutes brushing.
Okay.
Whether with a manual or with an electric brush.
What would you recommend?
I prefer the electric ones, especially the newer models has got a timer on.
All right, great. And do I brush vigorously with an electric toothbrush, or do I just let it do its thing in my mouth?
Remember, the electric toothbrush is already doing the job for you. So all you really need to do is hold it against your teeth, facing the bristle slightly towards the gum, and just hold it so you can do tiny back and forth movements if you really want to, or small circles, but no long strokes.
Then flossing, oh, my worst. Hey, I've got to floss, do I?
Yeah, you've got to try to clean in between, whether with floss or with any other aid, but you've got to try to clean in between.
How often?
Once a day.
Once a day?
Once a day is fine. I advise the patients maybe floss in the evening, which you've got a little bit more time. Try to clean in between.
So you've got some traditional floss there,
yes,
but you've also got something that might be quicker than flossing.
Yes. A lot of patients complain and say, oh, I can't get the floss in between, or it's cutting my gum, or it's sore. If you first of all are using the right brand and the right technique, flossing shouldn't be a problem. If your gums bleed while you're doing it, you're either not doing it correctly or not regularly enough.
So, Dirna, you talk about the right flossing technique. What is that?
Should I show you?
Yeah, please do.
Okay. Take a piece of floss, about 30 centimeters long.
Okay.
Wind it around your middle fingers and not your index fingers.
Okay, good point.
Should I show you in your mouth?
Sure, hold on a second. Let me just get my teeth out for you.
Lovely. Okay. The piece that you use in between your fingers, keep it nice and short. Okay. Go in with a nice, gently back and forth movement until you pass the contact point. Fold the floss around the tooth. You go up and down against this side.
All right.
You go over the gum and up and down against that side, and then you pull it out.
Brilliant.
And then we've got a lot of other things that can make life easier and faster.
Faster is good for me, because remember, I've only got 1 minute left of my 3-minute routine.
Only 1 minute left. This is a floss handle. It's already got the little floss in between for you. So once you finish flossing, you just pull on this handle and put a nice clean piece for you in between.
Like that. That's
very easy.
Right. So that's good for periodontal gum disease.
This is your basics.
People have that, so you've got to do
this needs to be done every day.
I thought mouthwash was a basic as well. Yes, no?
You know what? You need to remove plaque manually, and this is what a lot of patients don't understand. You cannot rinse plaque off your teeth. You need to remove it manually.
Fantastic. Dirna, thank you so much. So in
Pleasure.
summary, you can prevent gum disease and potentially heart disease by brushing twice a day, flossing once a day, and if you have time, use a bit of antiseptic mouthwash, obviously toothpaste, and get regular checkups and cleanings. I think that would make a big difference. Researchers may be unsure about the connection between gum disease and heart health, but other studies have identified gum disease as a risk factor for diabetes, premature low birth weight babies, and even Alzheimer's. So get into a simple routine and commit to it. Beyond just having a great smile, your entire body will thank you for preventing a number of common diseases later.
Your heart needs to be strong to keep up. Flora for a strong heart today.
September is Heart Health Awareness Month, which is why we're teaming up with Flora and challenging you to make better dietary choices and donate your heartbeats for your own good and for the good of others. Every time you purchase a limited edition Red Flora Light value pack from Pick n Pay, you'll donate 4,200 heartbeats to our heartbeat collection. Once we've collected 1 billion beats, they'll be used to upgrade a cardiac facility across South Africa. Visit florastrongheart.co.za for more info and to find out how you can donate more heartbeats.
I wanna live the best life.